Hello friends, welcome back to my channel Medicine of Onziron. Today we will talk about amniotic fluid and its complications. So amniotic fluid is nothing but what? It's the surroundings or the environment of the fetus. That means in a word you can say that amniotic fluid that surrounds the fetus during pregnancy, right? It protects the what? It protects the baby or the fetus over here. Now before going in details of the amniotic fluid and its complications, let's have some words about the features or the properties of the amniotic fluid. Now see the properties of the amniotic fluid over here. We can say in terms of see, gravity, specific gravity in terms of osmolality. You have to mark up these things. pH is nice concept over here about on pH. Okay, the color, the order, the the tonicity in terms of the hypotonic or isotonic, and this was the differential diagnosis. That's why I have written in the different color, right? Now see, the gravity, specific gravity is 1.0082 to 1.0010. The osmolality is 260 milliosmol per liter. The pH that will be from 7 to 7.5, average 7.2. Normally the color is colorless, right? It is colorless, but at term conditions we'll get to see turbid, cloudy or straw color. And if we say in terms of the order, it will be orderless. In terms of the tonicity, it will be hypotonic with respect to maternal or the the let's define it once more. The amniotic fluid that will be hypotonic with respect to maternal or fetal plasma, and it will be isotonic with respect to fetal urine. Hope it's clear for you. Now see the vaginal pH. The vaginal pH that is near about 3.5. The vaginal pH that is near about 3.5. Now see, whenever we are getting 3.5 the vaginal pH, sometimes you can get to see during pregnancy the vaginal discharge, along with the also you can get to see the amniotic fluid also over here. Now to differentiate whether it is the vaginal discharge or it is the amniotic fluid, we can have the litmus paper. Now on the litmus paper, if it is acidic, it will be cut because the vaginal pH is what 3.5, it's acidic in nature, and the pH for the amniotic fluid 7.2 around, so it will towards the basic in nature. So by using the litmus paper, you can have the confirmations whether it is the vaginal discharge or it is the amniotic fluid. The vaginal discharge means what? Basically, as the vagina is not having any kind of the gland, so from the cervix, the secretion that will come out in terms of the vaginal discharge, right? Another thing, sometimes we can get to, we have, I think you have heard this term, the foul smelling odor. The foul smelling liquor, sorry, the foul smelling liquor. So if we get to see the chorioamnionitis, okay, the inflammation is over here. So as a result, we can get to see the foul smelling liquor. That is also known as premature rupture of the membrane. Premature rupture of the membrane. So the foul smelling color, basically, we can get to see in terms of chorioamnionitis. 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 In terms of premature or rupture of membrane. Premature, I am writing the full form. Premature or rupture of membrane. Okay, so these are the properties you can get to see from here. Now see, we can also differentiate the urine. If we say for example the order, by using the order term over here, by using the order property of the amniotic fluid, you can differentiate whether it is the fetal urine or is the what? Fetal amniotic fluid. So as we know that the amniotic fluid is not having any kind of the order, so it's the orderless. But urine will have what? Specific type of the order. So by the order features of the amniotic fluid, we can differentiate in between the fetal urine or fetal amniotic fluid, right? Now see, that's another important thing over here. Now as we know, yes, the amniotic fluid is over here, but from where the amniotic fluid will come? Or we can see in a word, the source of amniotic fluid. So what are the source of the amniotic fluid in the different gestational age, right? So I have written over here, see, the gestational age in the first trimester from 12 to 20 weeks, from more than 20 weeks, and the main contributors. And see over here a little diagram. Now see within the first trimester, the amniotic fluid that will be collected from by the filtration of maternal plasma, through the placenta. So within the first trimester, the amniotic fluid that will be collected from the maternal plasma filtration by what? Through the placenta. So we can say write it over here that within the in the first trimester the amniotic fluid that will be from the filtration of maternal plasma through placenta. So we can write it over here in the first trimester. Okay, maternal plasma filtration through placenta. So see, what did I say? In the first trimester, the amniotic fluid that will be in the form of, or that will be from the amniotic, that will be from the filtration of maternal plasma through placenta, right? Now see, from 12 to 20, from 12 to 20 weeks, right? The fluid that will be the amniotic fluid that will be from where? From the fetal skin. So fetal skin is having one of the important role to contribute the fluid of amniotic. Okay, or you can say the amniotic fluid as a contributor of amniotic fluid. So from 12 to 20 weeks, the fetal skin that will work as, or that will be the source of amniotic fluid. And beyond 20 weeks, or 20 weeks after that also, okay, beyond 20 weeks, the fetal urine that will be the contributor of amniotic fluid, right? So if I just consider as the fetus, from here we're getting the two types of the things. On we're getting the, for example, the fetal skin, the number one, the number two, the fetal skin, and for example another is number three, that is over here the fetal urine. Now see, overall the main contributor, there's the frequently asked questions. Overall the main contributor of the amniotic fluid, that will be the fetal urine. Right. Now we'll talk about some specific conditions. For example, if the placenta is large, what did I say? Just try to listen to me very carefully. If the placenta is large, there will be more blood vessels, more capillaries, so there will be more filtrations. As a result, the amniotic fluid that will be more. Instead of that, if we get to see the small placenta, so there will be less blood vessels, so less filtration, so ultimately we'll get to see the amniotic fluid that will be also less over here, right? So let's talk about those conditions, the conditions where we'll get to see the large placenta and small placenta. So let me write it over here. The conditions where placenta in one part I will write it's big, another part I will write it small, right? So let's talk about those things. Okay. Now see, the big placenta we'll get to see in multiple pregnancies. The first thing we'll get to see in multiple pregnancy. So multiple pregnancy. Number two, we can get to see in terms of in diabetes mellitus. In diabetic conditions, we can get to see the big placenta. Third thing, okay. So during multiple pregnancy, okay, during diabetic conditions. And also we can get to see in RH incompatibility. RH incompatibility. In these three conditions, basically we will get to see the large placenta or the big placenta. So whenever the size of the placenta that will be large or big, what we will get to see in these cases? There will be more blood vessels. Okay, so from here more filtrations. Now from more filtrations, ultimately we will get to see the amniotic fluid that will be more. So from here, ultimately we can write it over here, the filtration that will be more, and from here we can say that the amniotic fluid that will be also more. There are certain conditions where we will get to see the size of the placenta, where the size of the placenta that will be small. So what are those conditions? So for example, we get to see IUGR, intrauterine growth restriction. If we get to see the PIH, or if we get to see, for example, the torch infections. See, what did I say? There are certain conditions where the size of the placenta that will be small. For example, IUGR, intrauterine growth restriction, PIH, and torch infection. In these conditions, the size of the placenta that will be small, as a result, less blood vessels that will go through their regions. So that less filtration. So whenever the filtration will be less, so ultimately the volume of the amniotic fluid that will be also less. So let's write it over here. So the filtration that will be less. So the amniotic fluid that will be also less in these cases. Oligohydramnios, the polyhydramnios. Okay. Now, yes. Now we have to talk in certain types of the things. For example, if we get to see that some abnormalities. For example, as I said over here, the different line marks in the first trimester, in the second trimester, and the third trimester, right? Now see, by the end of 20 or 22 weeks, the fetal skin that will be keratinized. What did I say? Around 20 to 22 weeks, the fetal skins that will be keratinized. As a result, it will stop producing what is amniotic fluid. After that, it will take over the responsibility that will be upon what the fetal urine. But certain conditions, for example, if we get to see some problems, for example, if we get to see some neural tube defect, right? Omphanocele, the neural tube defect. In that conditions, we'll get to see the transudate, right? What did I say? The transudate, the secretions for the for the transudate that will be increased. So ultimately, we'll get to see the amniotic fluid, the volume of the amniotic fluid that will be also increased. So what did I say? It's very important thing over here. So let's write over these things. Just don't forget the overall the main contributor that will be the fetal urine. Overall, the main contributor that will be the fetal urine. So just remember the fetal skin for its I'm writing by 20 to 25 maximum weeks. The fetal skin that will be keratinized. What did I say? That will be keratinized. And once it will be keratinized, it will stop producing the fetal amniotic fluid. Okay. So fetal amniotic fluid, that production that will be stopped. But certain conditions where the transudate, the secretions for the transudate that will be increased. For example, if we say over here the neural tube defect. So what did I say? The neural tube defect. I am writing briefly, so just understand N for neural, T for tube, D for defect. So neural tube defects, or for example, omphanocele. In these conditions, what did I say? The transudate, the secretions of the transudate that will be increased. So in these conditions, the transudate that will be increased. So whenever the transudate that will be increased, at that time, the amniotic fluid, the secretion for the amniotic fluid that will be also increased. And another important thing, by 22 weeks around, we can say, the fetal urine, okay, you can write it over here. By 22 weeks, the fetal urine that will work as the main contributor of amniotic fluid by 22 around. Now there are also certain conditions. There are some certain types of the medications that will decrease the volume of the amniotic fluid. So what are those medications? For example, if any individual who is taking the ACE inhibitors, now whenever he is taking ACE inhibitors, ultimately we will get to see what type of the thing we will get to see. There will be the reductions of the urine production. So ultimately the volume of the amniotic fluid that will be also decreased. For example, another kind of the drugs. So who is taking the indomethacin? The same condition we will get to see. The volume of the amniotic fluid that will be also decreased because the urine production that will be also dropped dramatically. So let's write over all these things over here. Okay. It's very important, so I can't erase it. So let's write about these things here. So there are certain conditions where the amniotic fluid that will be decreased. So for example, any individual who is under AC inhibitor, for example, any individual who is under AC inhibitor, in these cases will get to see the urine production that will be less. Ultimately, the amniotic fluid that will be also less. Or any individual who is under endomethacin, endomethacin, the same types of the mechanisms, urine production, I'm so sorry, that will be also less. So ultimately the amniotic fluid, the volume for the amniotic fluid, that will be also less over here. Okay. Now there are certain kinds of the conditions. For example, the maternal conditions and the fetal conditions where we'll get to see the volume of the amniotic fluid that will be increased or decreased. So for example, from the maternal point of view, where the amniotic fluid, the volume for the amniotic fluid that will be increased. For example, if we get to see the maternal diabetes mellitus, okay. In these cases, we will get to see the volume for amniotic fluid that will be increased, right? Wait 1 minute, let's do this part. Okay. And another important thing, if we get to see the fetal urine productions, that's also very important. The amniotic fluid that will be less. Whenever we get to see, for example, the fetal urine production, if it is less, definitely the amniotic fluid that will be also less. I mean, which conditions we will get to see the fetal urine produced that will be less? We can get to see in polycystic kidney disease, polycystic kidney disease. For example, you can get to see in terms of the Listeria infection. So in these conditions, we'll get to see the the amniotic fluid that will be less, because there will be less urine productions. But in these cases, what it is in maternal diabetes, the volume for the amniotic fluid that will be increased. Okay. Okay, now we'll talk about the different kinds of the gestational age and the what type of the volume we'll get in different age group of the gestation. Okay. Now see, it's very important. It's very important, and in fact, in different years, the different kinds of the questions has been asked from the different kinds of the gestational age with respect to the volume of amniotic fluid. Now see, in the 10th weeks, the volume of the amniotic fluid that will be 30 ml. At 12 weeks, it will be 50 ml. At 16 weeks, it will be 200 ml. At 20 weeks, that will be 400 ml. See, I have marked with the red color over here. At 34 weeks, the volume of the amniotic fluid that will be maximum. What did I say? At 34 weeks, the fluid of the amniotic fluid that will be what? Maximum. At 34 weeks, the volume of amniotic fluid that will be maximum. So that will be how much? Near about 1000 ml or 1 liter. So it's very important at 34 weeks, the volume of amniotic fluid that will be maximum, that will be 1000 ml or 1 liter. Or sometimes in some books they mention it's in around 32 to 34 weeks. They just talk about range. So if we just write the range, so the range will be around 32 to 34 weeks, and it is maximum. After that around at term or 40 weeks, the volume that will keep on decreasing. The volume that will keep on decreasing. So when at 40 weeks, it was 1000 ml, right now it is 800 ml. So right now it is 800 ml. So in these cases, the volume that will keep on decreasing, and around 42 weeks or beyond 42 weeks, the volume that will be 200 ml. The volume that will be 200 ml. So at 24, sorry, at 42, what did I say? Around 42 weeks or beyond 42 weeks, around 42 weeks or beyond 42 weeks, we'll get to see the volume of the amniotic fluid, that will be 200 ml. Okay, so at 42 weeks or beyond 42 weeks, beyond 42 weeks, so the volume will be less, it will be around 200 ml. Okay, now another important question that is asked, that what type of the hormones we'll get to see in amniotic fluid. Okay, let's talk about those things. So it's also important. So what type of hormones we'll get to see in amniotic fluid? The hormones or the hormones present in the amniotic fluid. So the topic that will be started in terms of composition of amniotic fluid. Composition of amniotic fluid. So near about 98 to 99% that will be, fluid, that means the water. Or yes, there is no nutritional, it's very important, there will be no nutritional association. No nutrients. There are presence of certain kinds of the hormones over here. What are those hormones? From here you can get the questions. Okay. So we'll get to see the prolactin. We'll get to see the insulin. And another important one, that is the renin. So what did I say? Whenever we said the compositions of the amniotic fluid, as far as the composition of the amniotic fluid is concerned, we'll get to see 98 to 99% around water or the fluid, whatever you can say. And there is no nutritional association. And we'll get to see the presence of the three kinds of the hormones. What are those? The hormones are prolactin, insulin, and renin. So this is very important questions as far as the composition of amniotic fluid is concerned. Okay, so keep watching this one. Now we'll talk about how to measure the amniotic fluid. Let's measure. Now we have discussed everything in terms of the volume, in terms of the different gestational age. Now we have to measure the amniotic fluid, right? So how can we measure the amniotic fluid? For that, the investigation of just choice, that will be the investigation of choice, that will be ultrasonography, USG, of course, USG. Okay, so let's measure the amniotic fluid. Okay, let's see this part. So how can we measure the amniotic fluid? After that we'll talk little MCQs, then that will be for today. We'll see. Measurement of amniotic fluid. And for the investigation of choice, it is nothing but the USG. So by USG, we can go for the measurement. Now in these cases, basically we'll divide the whole abdomen into two parts, upper abdomen and the lower abdomen. Okay, so first let's divide the abdomen. So yes, you can use this color. Okay, so it's the umbilical regions, and we will divide. Wait 1 minute. Let's show the diagram for you once. Yes. So I'll take the umbilical regions over here. I'll divide this one with the four parts in the four quadrants. And I'm just drawing this line, see, transversely. So this is the line that will divide the abdomen in the four regions, right? And we'll get the four quadrants. And in the four quadrants, we, as you know, there will be the presence of the different kinds of the organs. For example, the here, for example, I'm just drawing one organ. Wait a minute. Anyway, we'll get the different kinds of the organs over here. Okay. Now we are getting the different kinds of the organs. Now how can we measure the amniotic fluid? Now the first things we should have the idea what do you mean by amniotic fluid index. So what do you mean by amniotic fluid index? It's very important. Amniotic fluid index. So as we know, we'll get the different kinds of the organs over here, and we'll get to see on the, if on the USG we'll get to see also the fluids over here. And wherever we'll get to see the fluids, we have to draw a maximum or the largest diameter vertically. So we have to draw the vertical line. We have to draw the vertical diameter over here, the largest vertical diameter. For example, we'll get the largest vertical diameter over here. For example, the largest vertical diameter will get over here. We'll get over here. We'll get over here. So we have to draw the largest vertical lines in the different in each quadrants. In each quadrants, we'll get to see the fluid, amniotic fluid, and wherever we'll get to see the amniotic fluid, in which organs we'll get to see the amniotic fluid, we have to draw the largest vertical diameter in those particular regions, and we have to add. So what is amniotic fluid index? It is nothing but the addition of a largest vertical diameter in each quadrant. So this is the amniotic fluid index. But one problem is over here. What kind of the problem is this? That in in twin pregnancy. Okay. For example, if we get to see the twin pregnancy, in that cases, it will be not helpful. For that thing, we have to use the single most. Okay. Single vertical diameter. So the investigation of choice. Okay, that the best investigation that will be done by, for that thing, I have to take the largest on. And here another important thing after additions over here, after additions we'll get to see near about how much, 5 to 25, around 5 to 25. Okay, if we get to see less than 5, or if we get to see more than 25, we'll get to see the different conditions. Polyhydramnios, here we'll get oligohydramnios. Okay, so if we get to see that the amniotic fluid index that is less than 5, okay, let's write it over here. So what did I say? That after additions of the largest vertical diameter in each quadrant, after doing the additions, the normal range we are supposed to get around 5 to 24. The normal value for the amniotic fluid index, that will be from 5 to 24. So the normal value, so what did I say? The normal value of amniotic fluid index, that will be from 5 to 24. If it is less than equal to 5, it will be considered as oligohydramnios. And if it is more than 24, for example, equal to, then it will be considered as polyhydramnios. amnios. Okay, hope it's clear for you. Now, what did I say? The single best investigations for say the twine or the normal pregnancy, that will be the single vertical diameter, and we have to take for the largest one. Another name is single, deep diameter. Terminology that is known as single deep diameter. But for now, we can use the single vertical diameter. For the largest one, we have to take the values, and if we get less than equal to 2, or if we get more than equal to 8, if we get less than equal to 2, it will be considered as in the same way oligohydramnios. And if we get more than equal to 8, it will be considered as polyhydramnios. That means the more amount of amniotic fluid. Now we'll talk about some colors. Okay, some colors of the amniotic fluid. So basically, you can get the different color of the amniotic fluid. We can get in terms of the green. We get normally what did I say? It will be colorless. But in certain conditions, we can get to see the different color of the amniotic fluid. Now, as far as the colors are concerned, we can get to see the green color.